Everyone, happy Friday. Thank you so much for joining us. Our environment plays a significant role in our health. The impact that our stress, the chemical we encounter, diet, and more can have impact far beyond our lifetime. So study shows that our environmental health can have an impact on the health of future generations. And environmental chemicals can alter hormones, cross the placenta, store in fat tissues, and more. While many of this is out of our control, we must focus on the things that we can control so that we can set ourselves and our future generations up for success. That's why we're really excited today to be chatting with Amelia Harman. Amelia is a board-certified women's health nurse practitioner with experience in functional endocrinology, autoimmune disease, and female sexual dysfunction. During this live, we're going to discuss steps to take during preconception, the role of gut health in a healthy pregnancy, and how environmental chemicals can impact future generations of families. So I saw. Oh, here she is. Hello, hi, Amelia.
Oh,
How are you?
good. How are you?
Thank you so much. I'm good. So thank you so much for joining us. Tell us a little bit about your background, yourself, and how you became a board-certified women's health nurse practitioner.
Okay. So I've been an RN for 8 years prior to deciding to be a nurse practitioner. I didn't do anything women's health before that. Um, but I always had a liking for women's health because two of my aunts couldn't have children. And I always was afraid that that gene would be passed on to me. So I wanted to do everything in my power to prevent that gene from expressing so that I could be fertile. And So I was interested, and then I said, you know what, I'm going to go back to school for women's health. And I went the conventional route. I went to Cal State Long Beach as got my women's health nurse practitioner master's degree. And my first career as a nurse practitioner ended up being in an integrative medicine center, which is exactly what I wanted to do. The fact that I got to do that immediately from school was a blessing. So yeah, here I am.
Wow, that's super cool. And yeah, you've worked in like endocrinology and sexual dysfunction, and do you see a lot of overlap in, one affecting the other?
Definitely, definitely. So sexual dysfunction can be like anatomical, emotional, and all those things. But from an endocrinology perspective, if a woman complains of low libido, it could be due to like low testosterone, low DHEA. It could be to too much estrogen compared to progesterone. And so when we have estrogen metabolites that are overwhelming, it can interfere, and then women are going to not be ready to have sex. And then also, as far as like the tissues, if you have low amounts of estrogen, as in menopause, then you're going to have more pain during intercourse and decreased pelvic floor function. And so all of those things can contribute to sexual dysfunction.
And then all of these, I mean, we talked about fertility a little bit, and that's like one of your main reasons to become like a women's health nurse practitioner. So let's start with like, trying to conceive the
Right.
preconception phase.
The step one.
Yeah, step one, which is actually setting the foundation for a children's health, or like a child's health, right? Like many couples, kind of underestimate the importance of this planning stage before the conception. And then you also actually mentioned that, your gut is a really good, you mentioned getting your gut in a good health within the 6 months of trying to conceive is super important. Like, why is that?
Okay, so there's multiple reasons. One of them being like your gut is a big source of hormone elimination, right? So not only to eliminate and also biotransform. So whether you're going to have harmful estrogen metabolites recirculating or coming out, right? But also our gut microbiome as a woman is passed to our fetus in pregnancy. So our oral and our gut microbiome go to the baby in utero. And so it's very important. There's actually studies that show women that have eczema, obesity, or other metabolic conditions pass that same microbiome pattern to their children through pregnancy. And so if we can prepare our gut before we get pregnant, then we're going to have better outcomes for our children, not only during pregnancy to have a healthy pregnancy, right? But also that baby's life as they become an adult. So
I do think that's also important because, I mean, I don't know this part of the research, but I've read, natural birth versus C-section. Your mom also pass that microbiome to the kid, but it actually start way sooner based on what you just mentioned. Like it's actually during the pregnancy.
Yeah.
So if you end up having like C-section, I mean, sometimes that's not by choice that you just, it's a must. But if you have prepared yourself, before getting to that stage, then that's also setting your kids up for success.
Definitely. Yes, for sure.
So any tips for optimizing your gut in hopes of conception?
Yeah, so I actually have like a little protocol I made. So anybody watching willing to send it to you. So it's like remove. So we're gonna remove harmful gut foods, like inflammatory foods, the common ones being like gluten, dairy, corn, soy, sugar, and of course anything that is endocrine disrupting, which we might talk about later. But we want to remove those things from our diet, and then we want to repair. So any bit of like gut lining, any damage that was done over time, we can repair. There's different herbs and ways to do that. And restore is going to be like fermented foods, probiotics, getting your rest because we always want to think about emotional health. And I think that it's those are some basics that you can do, prioritizing rest, stress relief, and then eating the right foods too for the gut microbiome. So some foods that are really good are going to be colorful fruits and vegetables with fiber. That's going to feed different species, which is good for the gut.
Mhm. I know you're also a big promoter for exercising. So what role I've seen your posts and I know you're like super strong. So what role can exercise play in setting your body for a healthy pregnancy?
Yeah. So exercise, oh my gosh, there's so many things, but basically, when it comes to being able to get pregnant, so one thing that is harmful to our ovaries is too much insulin. Okay. And so high insulin levels could be due to diet and stress. And exercising is one way to actually decrease those insulin levels and to get sugar into cells instead of sugar in the bloodstream. And that's one way. Another way is to increase blood flow to the pelvic organs, so the uterus and the ovaries. So more blood flow means more oxygen, and which means more reproductive chances and successes. And also just overall stress relief is good. Giving that stress hormone down for better outcomes for you and the child.
A- Added benefit is when you sweat more, you also get rid of your environmental toxins.
And that's another thing, getting rid of environmental toxins. Yes.
You had a really great post about how fertility foundation begins at birth. So what does this mean and why is it true?
I love this question. There's so much to say about this. So, we did talk about prenatally, right? So, in utero is where it actually begins, um, where there's studies that show women that take antibiotics during pregnancy and even before pregnancy can have an altered gut microbiome that they pass. So, trying to avoid that. And of course, if you have to take antibiotics because things happen, then being focused on restoring your gut microbiome. So, probiotics and good foods, fermented foods. Then, as you mentioned before, when it comes to how the baby is delivered, there are elective C-sections. I know a lot of women elect for that. I would discourage that as much as possible, as long as it's safe, because as the baby passes through the vaginal canal, the baby gets the mother's vaginal microbiome in the baby's eyes, nose, mouth, and that starts to colonize not just the gut, but the entire body. We have bacteria all over our body. And so that's huge. And things happen. If you have to have a C-section, then I would recommend getting a swab from the vagina. I know this sounds so weird, but it's so good. Like getting that swab and having the doctor or you putting the bacterial microbiome on the baby's eyes, nares, and around the lips, so the baby can get colonized immediately. So things that are within our control, right? And then, of course, breastfeeding. That first bit of breast milk, the colostrum, is really foundational to creating the gut microbiome for the child. And so once you give that, um, at the very least, the colostrum, ideally you breastfeed for a good amount of time, but I know things happen, but really making that a priority because once we give a baby formula, now we're introducing inflammatory, not only inflammatory macronutrients, but also chemicals, because a lot of it is not organic. So right away, we're already getting those environmental toxins through formula, and it's damaging gut microbiome. And then going forward, the first food for infants usually is infant cereal. And that infant cereal is bombarded with glyphosate or pesticides. And so right away, 4 months, we're giving the kids, and this is not to make anybody feel guilty, but just to be aware and conscious. There are better formulas, right? You could choose better. There are better foods to give your child for first foods. I would recommend not giving a grain as a first food, maybe a vegetable. I personally gave my daughter avocado. Um, so something that's going to be good and healthy for that gut microbiome. And so, yeah, as parents, we have the control in the beginning, at least, where what we introduce our child to is going to set them up for a life of metabolic health or disease. And yeah, so it's good to be aware of that.
Your daughter is very lucky.
Oh, thanks.
And I know you mentioned endocrine disrupting chemical, and then we're all about it. You're advocate for avoiding endocrine disruptors, and for those who are unaware, what are these, and then what do you recommend people do who are getting pregnant and trying to what they should be avoiding?
Okay. So endocrine disruptors. So we say endocrine, we're talking about hormones and the system of hormones. Hormones are little chemical messengers, right? Um, they send signals to cells. And so these endocrine disruptors, they can mimic our natural hormones enough to like barely fit on the cell receptor, but enough to either elicit a response on the cell. So the cell is like, oh, this is estrogen. Let's act as estrogen. And then we're having a problem because that's not estrogen. Or it can block the receptor. So our natural hormones can't act on the cell now. So it's just sitting there blocking, and we have enough circulating estrogen, but it can't act on a cell. So we're going to have hormonal imbalances. Um, and and then it can also just be there causing inflammation. And some of these actually are toxic to DNA. So it's what we call cytotoxic. And as that DNA replicates, it can cause misfunctions, which can cause cancer. And so that's how important these endocrine disruptors are. So what are they? It's plastics, phthalates, parabens, dioxins. There's a lot of chemical names for them, but they're present everywhere. And again, this is not to be causing fear. It's just awareness again, so that we can avoid them as much as possible. And so just really being diligent with your labels. I know on your website you have a list of products. I know that you offer that, right? Good, healthy products. I think that's amazing. Just being aware of brands, ingredients. There are different apps that you can use to scan your products to see if it's full of chemicals. And so um, be aware of makeup, lotions, soap, using plastic bottles or Tupperware. Even if it says BPA free, it's like put a letter after BP, BPD, BP, like whatever it is, it's still, it might come out later, it's a toxin. And so being aware of these things. And the thing is, we're not going to avoid every endocrine disruptor. So doing what you can that's in your control, and there's ways to detox them out. I don't like to use the word detox, but in a sense, yeah, because they get stored in our fat cells and our tissues. And so again, sweating, exercising, but also different herbs can bind them out. And that's what I would recommend, but just being diligent and avoiding it and buying better products, just being aware. We as women, we probably get exposed to, it depends where you read this number, but I've read anywhere from 200 chemicals a day. I saw something that said 70,000. And so I don't know if that's hyperbole, but like either way, too many chemicals we are exposed to, and we can control that by just choosing better products. And one,
Absolutely. We have also seen there's like a pretty like strong correlation with how many product you actually use and your exposures. So, get rid of unnecessary products that you don't need.
right. Yeah. And one thing I found really interesting, since we're talking about that, something like PCOS, which causes infertility in so many women, has been linked to endocrine disruptors in pregnancy. These babies are born with a lot of chemicals already in their body, unfortunately, and then the receptors for estrogen are damaged. And so then as they go through maturation and they're getting their normal estrogen cycling, they're not even able to have a cycle or grow a uterine lining because of that. So it's so pertinent that we avoid them, especially if we're thinking about pregnancy.
What role can a woman's hygiene routine play in EDC exposure, especially when dealing with older? Because that's a big one.
Yes. So, we think of a couple things. I like to think of being clean from the inside out. So we aren't going to really be having a lot of odor if we're eating the right foods. If we are staying away from chemicals. It's ironic because the more chemicals we use, the more we can have odor because now our body's trying to get stuff out. And so, women, we don't need to lather these artificial fragrance lotions on us to smell good. We should have our natural fragrance. Our skin is our largest organ. So, as soon as we put on some lotion, perfume, it's getting absorbed directly into the bloodstream, bypassing the liver, and now it's getting stored in our tissues. So we need to be aware of that. We don't need all that perfume. Deodorant, same thing. There's just natural options. There's better options. One thing I do want to bring awareness to is the word fragrance. So a lot of natural products have that word fragrance. And sometimes it's a natural fragrance and it's an essential oil. Just know the brand. But a lot of times it's a good, cheap way to hide some chemicals because what it is like the brand's special chemical formulation that they don't have to disclose what's in it. It's like because it's private. So who knows how many chemicals is in there? So just be aware of that word fragrance unless it says specifically that is made from essential oils. Um, so yeah, just avoiding, like you said, not using as many products if you don't have to. You don't need to spray primer, put something like I don't know. I see the layers. Just do a couple things and make it natural as much as possible.
Absolutely. Any other tips of setting generations up for good health and fertility?
Yeah. So I would say just being super hyper aware of things that are within your control. So, it's like we we can be hyper diligent and we can make ourselves get crazy about this stuff, right? I don't want you to get stressed, but I just want you to be aware um and just doing what you can. And um companies like what you're doing is amazing. Honestly, like where you're able to just be aware of what's your toxic chemical load. And once you know, you might think you're doing a good job. And then you get that testing and you see, oh my gosh, I actually have high levels of this. It's just good to be aware and then make changes and do what you can.
Yeah. I also want to caution people might have a lot of emotions when they find out that their toxic load is high and then you need to do it. But we're always trying to encourage people, the more you can't unlearn it. The more you learn, and once you learn it, you're just gonna practice and or do it slowly so you don't get stressed out.
Right. Yes. One thing at a time. Okay. That's really important. Good job. Yeah. Cause it's like one thing you can eliminate at a time. Like if you go crazy and try to eliminate everything, then you're setting yourself up for failure later. But it's like one product, replace it at a time. And it can be expensive too. And yeah, I think that's my
We
advice.
have a couple questions coming. One person commented, can't find a natural deodorant that truly works to remove odor and not ruin clothing. And another question, or another actual question is, does natural deodorant work when it comes to remove smell?
So ideally, we are eating very clean so that we don't smell too bad, right? Um, and that we're exercising and eliminating as much as possible. But you're right, there are a lot of natural deodorants that are you just have to find what's good for you. And I did
Yeah.
personally have to, yeah, native deodorant had worked for me um until it didn't. And so sometimes you have to just find what works for you. One that I do use, and I have no association with this brand, it's Buddha butter and it's a cream. It's natural, but you have to rub it under your arm. And honestly, that is the only one I found that really works for me. I don't know if you have any suggestions that might work for you.
I don't use really deodorant. Um,
Amazing.
okay, maybe, yeah, maybe thanks to Asian genes. But I take a shower after I exercise, and then usually, and I think I have experience like I will have some odor, right before my period because that's when you have a hormone shift. Maybe that's the time I will need a little bit, but other time I totally agree that I can actually see a correlation if I just like eat a lot of takeout. I can feel myself smelling, have a stronger smell. So I think that's like a really good point because that also one, if you eat healthy, it feeds into a healthy gut microbiome,
Yep.
you have less toxin and you smell less, and then you need to use less products. So it's just like it works like it's like really positive feedback.
Yeah.
So I think that's important. But the other thing I also want to highlight is I think there are many natural like deodorant out there. We have a few listed on our website that we have vetted for their ingredients. And then, as you mentioned, there are other apps that you can actually use to check. But I think this is also sort of an investment that you kind of have to try out because everyone have different kind of skin type, different feel, and might work for you, might not work for other people. So I think you just gotta have to try a few and then see if it works. Unfortunately, this is you have to spend money to figure it out, but I think once you figure it out, then you can kind of stick to it.
I remember when I was using regular deodorant, I even had to switch it up often. Like, and also I wasn't eating as healthy back then. So maybe that's part of it. But I would use the deodorant for like 2 months and then I would stop working. I'd have to switch it up. So I say, like, don't give up on finding a natural deodorant because you're like, oh, it doesn't work for me. They never work. It's not true. There are some that work and then they stop working. Kind of like natural or not natural. The chemical ridden
Yeah.
deodorant also gets to a point where it might stop. And so it's really about internal.
Right. I totally agree.
Yeah.
Um, Another question, does coffee lead to smell? Drinking coffee.
You know what? I don't think so. It just depends what you're putting in your coffee. If like if you're using those creamers that are full of like inflammatory oils or other chemicals where it says natural flavors. Um, or if you're using those artificial sweeteners that can make you start smelling because those are chemicals. Um, just depends. And of course, you want an organic coffee because coffee can be a source of endocrine disruptors too. If you're getting like non organic, it has a lot of pesticides. So just getting like an organic, good coffee shouldn't make you smell.
Yeah. I also want to encourage people kind of like talking about this, like thinking through where you're actually getting your exposures, like the product that you use most often. Obviously, you would have more exposure on that versus, if you just like use makeup like very occasionally, you probably don't need to worry that as much because you're not using that as much. So I would start with like stuff that you're using every single day that, starts, if you're not using a good product, start swapping out those because you're just because you use it every day, you're getting a lot of exposure from it.
Yeah, because it actually layers, right?
Mhm.
It's not like as quick as getting out of your body. And then you do have to pick your poison. Like sometimes you're not going to be perfect. And there are things. Coconut sugar's good. That's
Yep, yep.
good.
That's awesome. We're getting a lot of questions, but I know people can get really overwhelmed when they start this journey, compounded with if they already have some hormone issues or frustrated or not getting pregnant and stuff. So how can someone work with you?
Oh, yeah. So opportunities to work with me. I do have like a one-on-one fertility assessment where I actually sit down with you for 2 hours and we go through we do talk about chemical exposures and just general health and more in terms of fertility, but it can also be which is a part of fertility, but hormone imbalances. If you know you have a menstrual syndrome, then we can talk about that. And then also I do have a fertility freedom series where you get lifetime access to it and I'm teaching you all about the reproductive system, every condition that can impact the reproductive system, and then what to do about it from a holistic integrative medicine perspective. That is a lot of good information on there on that series, and it's not highly priced. So those are a couple ways that you can work with me. And if you're in California, um, you can always be a patient of mine, and we can actually dig a little deeper. And you can always contact me if you're interested in that.
That's so cool. Thank you so much for what you do. Because I think the courses must be like super useful. Because one thing we see is when you go to your doctors, even fertility doctor, many doctors are actually not trained on many of these like sort of integrative aspect. So only when you have that information, you can start advocating for yourself and asking the right questions. Because sometimes doctors are busy; they're not even thinking about it if you don't ask.
No, honestly, yeah, and I get a lot of patients like that where they're like, "My doctor never told me this stuff," and they're like mad at their doctor, and I'm like, "Give them grace because they don't know, they only know what they're taught." Like I was not taught any of this in my nurse practitioner school. And if I didn't have that heart to seek and to learn more, which I hope every doctor has that heart, right? Like so in a way, it's like, why don't you care? But also, it just people have exposure to different things that lead them on different paths. And so maybe your doctor at that time just didn't know. And so giving them grace, but also seeking until you get answers. It's like so many times you have symptoms that are just dismissed. I have so many patients that said their doctor said that they were crazy. And I'm like, no, you're not. Here, I see right here, you're not crazy. Like, this is legit. So yeah, just giving your doctor's grace, giving yourself grace, and keep seeking, because this is one life. You have one life to live and to be your best self.
Absolutely. Anything else you'd like to share?
Um, I found some statistics that I was like, let me share. They're interesting, right? So in 2018, the Endocrine Society presented research on how exposure to BPA during pregnancy can lead to alter brain development and behavior of offspring later in life. So it's huge to think about how much BPA do I have in my body and to detox it. And then in the EU, on the World Health Organization, the European Union, which the European Union is pretty strict when it comes to chemicals they pass, more strict than the FDA. But in the European Union, they tested and found that more than 1.8 million children each year are born with mercury in their hair. Like when they do a hair sample, they found mercury in their blood higher than the adjusted safety limit. And they estimate that the cost of burden of disease attributable to endocrine disrupting chemicals is at 157 billion euros a year.
Yeah. It's crazy.
So if this is not like something we need to take seriously, endocrine disruptors, it's huge. So I appreciate what you do, because it's amazing.
Yeah, we also need more people like you, because I mean, you probably are aware, many of your patients coming to you, people have no idea. Like, people just don't have this information. So we just like want a lot of people who can spread this information, so then people become aware, then do something about it.
Yes, absolutely. Absolutely.
This
I
is
appreciate
amazing.
you having me on here to help spread that, because I get so fired up about this.
No, this is awesome. Well, we should talk again, because there are so many other topics when it comes to women's health, and then also your practice and everything.
Yeah, let's do it. I'm down.
Awesome.
Thank you.
Have a great weekend.
Thanks, you too.
Bye.
Bye.